Could you talk to me a little bit about depression and sort of what that means and how we, I guess, approach that from a primary care perspective?
Yeah, great, and thank you for having me here today, Manny.
It's okay.
Yeah, so often we as physicians will focus in on patients' medical problems, but when you go to look deeper at a patient, a lot of times depression is one of their medical problems that may be contributing to other things going on with their health. It's a big part of how patients are taken care of and how they lead their lives. So it's something that many doctors, particularly primary care doctors, need to be in tune with as they're taking care of a patient's diabetes or other health conditions, to really focus in on the mental health of their patients as well, because that affects everything that is going on with their lives.
So a patient who is having like typical signs and symptoms, that we're going to go to a graphic in a little bit, just classic, so just sort of general feelings of depression can sometimes escalate and maybe even go unaddressed. Could you try to be a little bit more specific as to what specific signs and symptoms we try to use to diagnose depression?
Yeah, generally patients, when they're depressed, will come in, they'll start to complain that they have a lack of desire to do things. They may be sleeping more or less, maybe isolating themselves from their family. The most extreme is they start to have thoughts that maybe they're better off dead, or don't want to be alive in this world anymore. Generally start to see a decline in their work relationships, family relationships. Some people become more active, some people become very less active. And when it really starts to affect their day-to-day life is when we want to address that issue.